Feeling anxious? It might not be what you think it is. Misdiagnosed anxiety, a prevalent issue that affects millions of Americans every year. According to the Cleveland Clinic, anxiety disorders are the most common mental health problem, impacting over 20 million individuals across the country. However, could it be that what we perceive as anxiety is actually something else? There are various types of anxiety disorders that can lead to overwhelming worry, panic attacks, and intense fear without any real danger. But did you know that other medical conditions affecting millions of Americans can have symptoms similar to anxiety disorders, leading to potential misdiagnosis? Let's delve into some conditions that both men and women should be aware of. Inflammatory Bowel Disease, IBD. IBD is a term used to describe a group of conditions that cause inflammation and swelling of the digestive tract tissues. As explained by the Mayo Clinic, ulcerative colitis and Crohn's disease are the most common forms. IBD affects approximately 3.3 million Americans, according to NYU Langone. While abdominal pain and cramping can lead to anxiety, it is also a symptom of anxiety itself. Postural Orthostatic Tachycardia Syndrome, POTS. POTS is a condition that causes an abnormally fast heartbeat when transitioning from a seated or lying position to a standing one. It affects between 1 and 3 million Americans. According to Johns Hopkins Medicine, POTS symptoms, such as heart palpitations, dizziness, and fatigue, can be mistaken for panic attacks, leading to misdiagnosis. Endometriosis. Endometriosis is a condition characterized by the growth of uterine lining-like tissue in areas where it does not belong, as per the Cleveland Clinic. It can cause pelvic pain, heavy menstrual periods, and fertility issues. Symptoms such as chronic pain and fatigue can contribute to stress and anxiety. Researchers estimate that over 6 million American women have endometriosis. Polycystic Ovary Syndrome, PCOS. PCOS is a hormonal imbalance in women that can result in irregular periods, excessive hair growth, acne, and infertility, according to the Cleveland Clinic. Hormonal imbalances associated with PCOS can lead to symptoms commonly found in anxiety disorders, such as fatigue and mood swings. Approximately 5 to 6 million women in the U.S. are believed to have PCOS, according to the Endocrine Society. Hyperthyroidism. Hyperthyroidism, a relatively uncommon condition, affects about 1.3% of people in the U.S., as reported by the Cleveland Clinic. Also known as overactive thyroid, this condition arises when the thyroid gland produces excessive amounts of thyroid hormone, accelerating bodily functions and causing symptoms like rapid heart rate, weight loss, and increased appetite. Other symptoms such as sweating and nervousness can be mistakenly attributed to anxiety. Lyme disease, a tick-borne illness, is on the rise, with federal health officials recording around 36,000 cases annually, as stated by Johns Hopkins University. This bacterial infection can cause fever, rash, facial paralysis, irregular heartbeat, and arthritis, according to the Centers for Disease Control and Prevention. However, it can also result in fatigue and cognitive issues that are often mistaken for anxiety or depression. And this is the part most people miss. Have you ever considered that what you're experiencing might not be anxiety at all? Could it be a misdiagnosis? Share your thoughts and experiences in the comments below.